Good afternoon, buenas tardes. This is Dr. Renteria, and I'm here with our interim director of our nursing department, Ms. Stephanie Larkins, and we're going to update you and give you some information on some upcoming vaccination days. Specifically, one is specific for children, and the other is also giving some information on a booster day that we're going to have. But before we do that, I wanted to just go over a couple of things because we haven't done this in a little bit. But what I want the community to know is that right now we're experiencing a significant surge in positive COVID cases here in the tribal community, and it's primarily in those that are unvaccinated. But what we're seeing is that also for those that are getting these infections, we're seeing more children being infected as a result of them obviously not being immunized, but it's coming from the folks that are unvaccinated. The majority of unvaccinated tribal members are less than 40 years old. Those that become infected in this group, as I mentioned, are at risk of infecting their unvaccinated children. And it also seems that COVID-19, especially the Delta variant, seems to be really good at finding those people that are unvaccinated, even though we have a significant number of those that are vaccinated that afford a level of herd immunity to protect those that are unvaccinated. But it seems that, boy, even with that, the Delta variant is finding those a lot easier than we thought. So what I'm going to do now is ask Stephanie to address the upcoming booster clinic that we have and the vaccination clinic that we're going to start for children, and give you some information along those lines.
Hi, good afternoon. So this week on Wednesday, because Thursday is Veterans Day, and we will be
mask off so they can hear you better.
We will be shut. We will be closed on Thursday. Our booster drive this week is on Wednesday from 2 to 6 at Albert Garcia Auditorium. We will be offering all 3 vaccines: the Pfizer, Johnson & Johnson, and the Moderna as booster doses to everyone 12 and up. No appointments necessary, and that vaccine event is open to the public. So we encourage you, if you have not received a booster or a first or second dose, to come on in and see us from 2 to 6 at Albert Garcia.
Now, Stephanie, why are we doing it on Wednesday when we've normally been doing it on Thursday?
We will be doing it this week on Wednesday because we will not be open on Thursday due to Veterans Day. So we'll move it a day earlier. No risk to anybody getting the vaccine a day earlier. So this worked out better, and hopefully we'll be able to reach some other community members that may not be able to make it in on Thursday. Good.
Okay, and can you tell us a little bit about, I think we have our first clinic for vaccinating children under 12 years old, which is the Pfizer one. Can you tell us a little bit about that?
Yes.
And I think folks are also wondering, like, well, what kind of symptoms are the little guys going to experience compared to adults?
Okay. Before I touch base on the children, the 5 to 11, we will have a little mini vaccination event at the senior center tomorrow for boosters for any elders that want to come in from 10 to 2. Right in the main lobby there will be a little vaccine pod set up to administer any boosters of the Pfizer, Moderna, or Johnson & Johnson. So, and that will be held at the senior center.
Can they just show up, or do they have to contact Maria Paisano?
No, you can just show up. Anybody can show up that wants a booster.
That's a senior?
That's a senior. That's correct. So we will definitely be giving those out as well. And we'll be reaching out into the community to give vaccines to those that cannot come to a vaccination pod, and we'll start that up on Wednesday for some homebound elders and community members that cannot get to one of the vaccine pods that we have. So if you want more information, you can definitely call the nursing department. The telephone number is 520-879-6119. All right, moving on to the children, what we kind of all have been waiting for, at least for the parents that want to get their children vaccinated in the age group 5 to 11. So right now we will definitely have a kids only vaccine event held this coming Saturday, which is November 13th, at the new Health Department building and Social Service Department. There will be signs put out front. Most everybody knows where the pharmacy entrance is, and that's where everybody will be entering in. We will be giving the Pfizer vaccine. and the children must wait 30 minutes. So we've planned a little bit of entertainment and some activities, some snacks. That will run from 10 a.m. until 3 p.m. And again, that is at the new health department building. So some facts and lots of questions that I've received, as well as the nurses have received on our end, is what can my child expect from this vaccine? How safe is this vaccine? Will it protect them from getting COVID? How come I should do something like this? Here's the thing, we trust the science. So as medical professionals, we trust the science and we trust the departments that are rolling out this information. So typically, if you received a Pfizer or Moderna vaccine, you probably had a sore arm, maybe had some fatigue, tiredness, slight fever, took some Tylenol, it was gone in about 24 hours. That's typically what these research participants, these children in this age group of 5 to 11, there was about 4,000 of them. Those are some of the typical reactions that they had. There was no children's deaths. There was no myocarditis. You may have heard that in the news as well with any of these. The effective rate of this vaccine in this population is right anywhere between about 91 and 94%. So it's very good. And right now we're seeing where a lot of the children are catching it at school and bringing it home to their parents, vaccinated or unvaccinated. So the Delta variant really does not, it doesn't care whether you've had the vaccine or not. It's looking for an open portal to infect a new person. And so while we see the vaccinated have a lot milder symptoms and don't end up in the hospital, we're still seeing both. So you've probably heard that it's a lower dose, so we'll be giving the children a lower dose. That's why we wanted to set up this vaccination pod that focuses just on the children from 5 to 11. Of course, if you have a child that's been on the fence or you haven't been sure whether to give the vaccine or wanted to give all of your children the vaccine at the same time, we definitely will oblige on Saturday and have a separate room set up for any children that are 12 and older. What other questions did you have, Dr. Renteria?
No, that's good, Stephanie.
Okay.
What I want to emphasize is that the difference for children now is that we have a lot more information of vaccines and their effects on adults and children because of the experience with the adults. Because I know a lot of adults are probably even more concerned about, well, I'm an adult, I'm willing to take a certain risk, and I don't know if this vaccine is going to help me, but you're still worried about your child. But I want to reassure you that because of even more information we have, we definitely know that it's very, very safe in children. This particular Pfizer one is over 90% effective. But basically trying to answer the question is, why should I get my child vaccinated? I think it's important for you to understand that of anything that's out there, the vaccinations or vaccines are still the best way to protect your child from COVID-19. We're dealing with the Delta variant. There's no assurance that there won't be other variants that may be specifically target children. But with more contagious variants of the virus, more young people are getting COVID-19 and being hospitalized. COVID-19 can cause an otherwise healthy child to suffer what's now an official diagnosis. It's called multisystem inflammatory syndrome in children. Basically, that's when your child, just like an adult, is trying to fight the virus. There's a lot of inflammatory processes that go on that can actually damage the person's internal organs, including the child. And this is prevented by the vaccine. So it is really important. And I think you should feel more comfortable that because of all the information we have now, that we know it's very safe in children. If you have any other questions, you can contact us at the health department. My email's out there. I'll be happy to take questions, and so will Stephanie. And if you have any questions about the information we just gave you regarding the vaccination sites and what we're going to do, please feel free to contact the health department. Anything else, Stephanie?
No, just one more time. So on Wednesdays, a vaccination pod at Albert Garcia Auditorium from 2 to 6. That's for 12-year-olds and up. We'll be offering all 3 vaccines, the Pfizer, Moderna, and Johnson & Johnson from 2 p.m. to 6 p.m. No appointment needed, and that is open up to all open up to the public. The vaccine event that we have planned for the kiddos from ages 5 years to 11 years is only open to tribal children.
At this time.
at this time.
And Stephanie, that's because of the doses that we were shipped to, correct?
That's correct. We have 300 initial doses to first give out. And so it's tribal children or dependents of tribal members. That's where our main focus is to protect the community. So we want to get those vaccines out into the community here, and the other communities as well. So our first rollout will not be open to the public. So if you have questions about that, please give us a call at the nursing department, which the number again is 520-879-6119. And that vaccination event for children 5 to 11 will be held at the new Health and Social Services building. You would enter in at the pharmacy, and that will be going on Saturday, November 13th from 10 a.m. until 3 p.m.
So Steph, just to make sure I heard right, okay, so correct me if I'm wrong. So with the vaccination for children, we're focusing on enrolled tribal members, right? But obviously if a child is not an enrolled tribal member yet, but their parents are tribal members, they're eligible.
That is correct. That is correct.
Great. So we're very excited to do this. We've been waiting months for the CDC to approve this in children. I'm really happy it got there, and IHS has been a really good partner in getting us the vaccination once it was approved as quickly as possible. So please take advantage of this. We'll vaccinate the first 300 children that show up, and then we'll see what happens next week, because we're going by week by how many doses we get. Thank you very much for tuning in.
Thank you.